guys, I'm Dr. Opperman, Simplicity Health Direct Primary Care. Many of you guys know me. Some of you are my patients. Super excited today. I have a special guest with me, the new partner in our practice, Dr. Wenzell. So Dr. Josh Wenzell is with me. And so I'm going to introduce you guys to him a little bit.
Excited to be here.
We're going to do a fun little thing with ICD-10 codes, and let's see what he comes up with. And you can see that we're wearing our Simplicity Health hoodies. We also have a Simplicity Health t-shirt here. So it says Simplicity Health on the front and the swag on the back. No waiting, no insurance rules, no expensive testing, just you and the doctor, simple. And so we're actually going to be giving away two of these, a t-shirt and a hoodie today. We sell them at the office. If anybody doesn't get them today and you want one, like everything else, we give them away for what they cost us. But yeah, so if you want one, we'll tell you at the end how you can get yourself one. All right. So Dr. Wenzell, tell me about yourself. Tell them about yourself. Like, where are you from? Your childhood? Where did you go to school?
Yeah. So I was actually born originally in Westerville, just outside of Columbus, but then grew up in Enon, not too far from here. So just outside of Dayton, went to Greenon High School, and then went to Furman University in South Carolina for undergrad.
Yeah. Very, very topical because...
It is, yeah. They just made it to March Madness. The first time in over 40 years that they've made it to the tournament.
The Paladins. Beat Virginia.
Yes, they did. Big upset. And it was...
then they got smoked next
Yeah. But, hey, for a pretty small school, we were pretty excited. Oh, yeah. Yeah. But, yeah, they got very smoked. I was actually a math economics major. Yeah. So, a little bit different. But did all my pre-med courses, and then I ended up going to medical school here at Wright State locally. So
it's really interesting, the math economics standpoint of things. Mm-hmm. And now you're joining a direct primary care practice. Yeah. So like, of any doctor in this world that understands like how the healthcare system works and where people are getting ripped off and where the flaws in this, like you're it, that's pretty awesome.
I mean, in undergrad, did health economics, and so studied and just talking about, how we can better align incentives economically and financially. A model like direct primary care, we briefly talked about it at the time, didn't know that it was going to start to grow as it kind of is starting to finally. But the idea is that it helps align patient incentives and our incentives, right? Rather than always wanting, it's better for you to use more healthcare. Yeah. Instead, this model really gets us to try to make our patients healthier. We want you to have to use less of our product with that.
Totally. So kind of piggybacking on that, we have a fun game today to try to, like a little icebreaker, I guess. Mm-hmm. And so in the insurance model, which we both practiced in, by the way, and it was terrible. But in that model, there is this coding system called the ICD-10 coding system. And so basically, for the people who don't know, this is a system where, the doctor sees you. So you come in for, your toenail hurt. And then you also had the sniffles. And so then the doctor would go back to the office, and then he would code, toenail injury secondary to bumping it on the sofa. And then there's another code for runny nose. And then there's another code for, cough. Well, the ridiculousness of these codes got completely out of hand. And so, and this is part of the craziness of the insurance model is that, doctors are wasting time. Instead of spending time with patients, we're wasting time coding for this kind of stuff, So this is going to be a fun game. I found some crazy ICD-10 codes. These are real codes. These are real things. I found some real diagnosis. Yeah. And so I want to get your opinion as to like how these things may have even occurred. Right. Okay. So just do your best.
All right.
So we're going to start with, we have like some animal driven ICD-10 codes. Okay. So there's like W53, which is contact with a rodent. That seems like you could have, I don't know why you go to the doctor with contact with a rodent.
Part of me is, thinking, it could just be you're petting the rodent. Part of me also imagines somebody like throwing a rodent at someone and making contact with them. But,
I mean, maybe it's like leptospirilliosis from rodent feces. Or, I don't know. But then now we have bitten by cow and then bitten by pig. So maybe it's a farmer or something.
I could see that. Yeah.
So now we've got some strange ones. Struck by sea lion, struck by orca. Struck by an orca at sequelae. So this is the second time you got struck by an orca. Struck by another fish. Struck by a turtle. Struck by a macaw.
Oh, well.
So, I mean, a macaw, if I'm not mistaken, I think is an endangered species.
I don't know if it's endangered or not. They are present actually, as a quick aside. So in Honduras, where I actually have family.
And you speak Spanish.
I do speak Spanish, yeah. So, but yeah, lots of macaws throughout Latin America and rainforests.
I thought they were endangered. Have you seen one?
I've seen lots, yeah.
Oh, so maybe I
held them in my hand. I've actually held one in my hand.
Did any of them strike you?
I don't know. Does clawing your hand count? What I guess.
I was thinking that was the least common of these, but maybe not. We have W61.43 is pecked by a turkey.
A good Thanksgiving code.
That is a good Thanksgiving code. My favorite one, I think, is W61.62XD, which is struck by a duck. And I think it's my favorite one because, like, can you imagine, like, you're there and like a duck is flying at you? What would you say? You'd be like, oh, blank. I've been struck by a duck. Fill in the blank.
Duck, it's a duck.
Yeah, right. So those are some crazy ones there.
Well, you must could have done I don't know if struck by a goose, more like you almost struck a goose on your way in today. Yeah, there were like these two geese that were fighting in front of you.
They're relentless. Like, geese are, I don't know.
They deserve some diagnostic codes of their own.
I know. They're geese are vicious. And like there's these America's Funniest Video things with geese. Oh man, my kids are terrified of geese because they've watched these videos of geese just attacking people.
They're wise kids. Those are. I hate geese too. So.
All right, so Dr. Wenzell, V97.33XD is the code for sucked into jet engine, subsequent encounter. So it's happened twice. So tell me a situation where
I'm thinking of somebody just like, looking at the runway and just being like, yeah, I can make it across in time. There's no way this can happen a second time that I get sucked in. No way. That can't happen. Once is enough.
And they lived the first time to get through the jet engine.
Well, I'm glad they lived the second time to be able to diagnose it.
Exactly. So. Very fair point. Yeah. We have Y93.D, which is activities involved with arts and handscraft. I mean, I think this is a real thing. I mean, I have a 7-year-old at home and he does like crafts with my wife and like this hot glue gun. I mean, that's dangerous.
Yeah.
I mean, so maybe that's a real thing. I mean, can you have anything? Is this a public health crisis with arts and crafts?
Yeah, I don't know. I mean, glitter, I've heard described as being very infectious, just being able to spread anywhere whenever you pull glitter out. That's true.
So you could get of the lung, maybe. We have 12.Z99.89, which all of us have, I think. That is dependence on enabling machines and devices, not elsewhere classified.
Our auxiliary brains or cell phones.
Exactly. What would we do without these things?
Oh my gosh,
They're like the work of the devil, but they're also awesome too, because they're like, as doctors, like I have an app on my phone and you can just click on it and you just pull up any diagnosis you want and you can literally learn about it instantaneously. Yep. That never existed.
Yeah.
Can you imagine practicing in like 1960? You'd be like, let me thumb through.
Let me go find a textbook that might have something related to it. And that's 10 years out of date by the time.
And then you'd have to prepare a tincture of something probably.
Yeah. Well, and the nice thing with it nowadays, and with direct primary care specifically, is how we have the time to actually go through and look that up too. Yeah. So
I can't tell you how many times that just happened to me the other day. So you do some OBGYN.
I do. Yeah.
I don't do any. I'm just an internist. You're a lowly internist. You're a family doctor, a man of all trades. So I don't do any OBGYN or pediatrics, but I had a patient the other day that she was having some like breast pain stuff. And I'm like, ma'am, I'm really sorry. This is not something I deal a lot with, but let me go look this up for you. And like, I spent like 15 minutes reading about what was going on. And so that way, you know, she left the office that day and it wasn't just like me throwing up my hands like, I'm clueless, I don't know. I at least could help her and send her in the right direction because, you know, I've got these enabling devices.
Absolutely. I mean, I think part of, you know, being a physician, we're always taught that we have to learn how to learn, right? Because the rule we heard in med school is that, you know, 50% of what you learn in med school is wrong. The problem is you don't know which 50% it is. You know, it's a constant learning process, which is great, but also something challenging. And that I think is important for us to stay up with it.
Totally. So, And you and I, we share that similarity. It was really important to me actually before I brought you on to make sure that we practice similarly and that we both really practice evidence-based medicine. So like, you know, we're not doing a lot of like stuff that is like very anecdotal or, hey, you know, I saw on TikTok, maybe if you take, you know, enough dandelion sprouts and mix it with some kind of tea, it'll cure your cancer. You know, like it's not how we practice, not how anybody should practice, but there are places that do that.
No, I agree. I think that having strong reasons for what we do is really important, and being able to explain that to patients is a huge part of it. The thing is that takes time, right? And in a traditional model, it's really hard sometimes to spend, you know, the amount of time it takes to explain why we want to do this, what options are available, why we may be uncertain about certain things too.
It's better. It's better for sure. You'll find out very soon. April 3rd.
I'm excited for it.
April 3rd. It's going to be awesome, man. You're going to love this. The problem is it's like once you go to this route of delivering healthcare, you can never go back. You will never work at another employed position with insurance. It's horrible, man. So welcome to the dark side, I guess.
Or to the light, I guess.
It's totally that way. So Y92.146 is swimming pool of prison as the place of occurrence of the external cause.
External, man.
So I don't even know what this means, frankly, but the reason I included it is like, what prison has a swimming pool?
Yeah, there can't be. That's a good question.
If I ever go to prison, I want to be I want to go to that one, right?
That's the one. Do
you think there's
the bougie prisons for, you know?
Do you think there's like a maintenance person that takes care of the pool at the prison, or do you think it's just scum water?
Oh, I don't know. Again, it may depend what kind of people are in the prison. So is it the Bernie Madoff or
who are you? I think it's probably Bernie Madoff and Martha Stewart at the prison swimming together. But there is an ICD-10 code. If you ever have a patient that has an injury or illness or contracted something from a prison swimming pool, you will not have a problem coding for it if you do such things, if you do such crazy things. This is one that Bonnie, I'm sorry, Z63.1, a real ICD-10 code is problem in relationship with in-laws.
I've actually used this one for before. Oh yeah.
No way.
Yep. I came in and it was a whole thing. I won't go into the details of the drama, but just the amount of stress was just unbelievable for him. The in-laws who had moved in, and it was not going well for anyone. Oh, I used that code before. Yeah. I'd actually seen it on a list of humorous codes, but I'm like, if there's ever a time to use it, this is the patient for it.
Some coder somewhere like in North Dakota or insurance company is like, no, this is not real. That is crazy.
Yep.
We have W220.2XD, which is walked into lamppost, hold it, subsequent encounter. So not only did it once, but you've walked into it twice and you've seen the doctor for it. So, I mean, I don't know. I think you think that's a psych referral.
No, I don't. I feel like that may be someone with vision. May need to check that a little bit more with it.
Could be.
Or, it may actually relate to the previous diagnostic code for use of machine or handheld machinery.
That is very
so, down in your phone and then smacking into the lamppost.
I bet this gets used more often. We should code them together. And then we can upcharge the billing.
You're right. You have the whole HCC.
Yeah. If you're texting with your in-law and you're you're enabling this device in your hands, and you walk into a lamppost multiple times.
3 diagnoses, right?
Yeah, that's a level 4 code. we can upcharge the patient.
That's very true. Yep.
Okay. All right. More on this ridiculous insurance model. So this is the craziest one, I think.
Okay.
There's a lot of numbers and letters here, but if anybody doubts me, it's like Y93.D V91 burned due to water skis on fire. How does that happen?
I don't know, but that'd be a pretty great photo. I feel like that
would be awesome. Like, you just want Instagram. If you get your water skis on fire and
while you're going with it.
But then we got a question. I mean, the site diagnosis we talk about, we have a question: who's taking the picture?
Yeah,
like your water skis are on fire, you're about ready to go up in flames, and like your mother-in-law that you have the relation problems with is taking the picture.
Don't help, just film.
Exactly.
That's the rule there. So,
all right, we got a couple more. We already talked about struck by McCall, so I can skip that one, which I thought
may have applied to me. Yeah, well,
I think you've been struck by McCall.
I may have. I have to say, I did not go to a physician, so they weren't able to diagnose me officially with it. But
well, probably in Honduras. You were in Honduras?
Yeah.
Probably they don't have these stupid codes.
Yeah. Well, actually, ICD is international. So,
is it really?
Yeah, it stands for International Classification in Disease. Yeah, manual. So it's used WHO. Yep.
Well, if someone there's somebody at NASA that's diagnosed this. This one is spacecraft collision injuring occupant. Sequelae, second time. So somebody at NASA has diagnosed that one, right?
Man, I'm impressed that you survived a spacecraft collision.
How do you live through spacecraft collision?
Man, yeah.
And it didn't injure the driver, just the
maybe it was just on the ground.
The second time.
Maybe it was while it was like being transported or something, and then that you were struck by it. But
that could be that. I would like to meet the person who did that. So that was really fun.
Yeah.
That's awesome. Let's move into it, and as we close up, tell me, Dr. Wenzell, why did you did this ridiculous insurance model where you're burnout, seeing thousands of patients a day as fast as you can see them, honestly, probably delivering not because of you, but because of the time constraints, the quality care that you didn't desire to deliver. Why you sought me out? Why did you come to a direct primary care practice?
So I had heard about direct primary care, I think, as I mentioned, actually in undergrad in economics class. And it was when we were talking about different models of how care can be delivered. And this was kind of just as an aside, like, this model has some great opportunities that come with it. It's just not implemented in the US where it's all kind of fee for service and insurance companies kind of drive it. There's been a recent push from insurance companies to try to do, more kind of quality metrics and do more reimbursement based on quality and not just quantity of care. But that's still early days for it. Sure. Direct primary care, that's now been around for a decade-ish or more than that. I think that it is solving a lot of the problems in it. Is it the single solution? No, it's not. But for primary care, I absolutely think that this has been a great option. Like you said, I love the idea of being able to spend more time with patients, being able to discuss more of the nuance in medicine what options are available, being able to do that shared decision-making model of being able to talk with patients, understand their values and what would be important for them when helping them reach their health goals.
I'm telling you, man, it's this relationship that you have with your patients where you go from they're just another patient to like, these are your family members. Like you love them and you care about them. It's awesome. Today we had this nice little lady brought us a handmade sign that we can hang on our door of like a Easter sign. You'll have patients bring you fruit and vegetables from the garden when it's harvest time. It's just like you go again from like this very impersonal thing to, like these are your people, and you'll go way out of your way to take care of them. So I'm glad you're here.
Yeah. And I mean, awesome. Leaving my patients from the private practice was absolutely the hardest part of moving.
Tell me about your philosophy of care. Like what makes you tick? What's
So to me, I think my role as a physician is to help people reach their health goals while respecting their values and preferences with that. And by delivering that evidence-based care, right? So things that I'm confident are able to help them, helping them understand what those benefits are, what the risks are. Unfortunately, any treatment we do also has risks with it. And totally. I think that that's super important for patients. While it may be obvious that this treatment is the best option, patients, I think, have a right to understand that there are other things that can go along with it and managing that. Yeah. So like I said, to me, it's being able to offer those services that I think are going to best help the patient while taking into account their own values and preferences.
Yeah. So. Why did you choose medicine as a career?
Yeah. So lots of reasons. I think medicine is a really cool interaction. I am very interested in lots of different things, and medicine, as kind of evidenced by some of those diagnostic codes, really hits a lot of different areas. Maybe those are on the sillier side of things, but the point is that, you get this really interesting mix of, kind of family dynamics, of health, of science, of math, of ethics, of just applying all these different fields that I think are, it's interesting to me on an intellectual basis, but more personally, I think it's great getting to know people. Patients come in sometimes the worst of times, right? The worst part of their lives for it, and being able to be there with them and be able to help them through it, I think is a great opportunity. And to me, is a vocation of a calling that I have to be able to care for patients like that.
Yeah, so, totally. It's, they come to us, tell us things they wouldn't tell their wife or their preacher, and trust in us. And it's more than a job, right? It is a vocation. Absolutely. It's a calling that's awesome. I feel the same way. So tell me, what ages do you treat?
Yeah. So all ages. Kind of saying we use is cradle to grave for family medicine. Yeah. So I have a lot of experience caring for all ages with that, and enjoy seeing the wide variety. It's kind of why I chose family medicine. In med school, we do all of our different rotations. So in pediatrics, internal medicine, surgery, OBGYN, et cetera. And as I was going through them, I was realizing, I like this one. And I went on to the next rotation. I like this one, or at least features of each one of those rotations. Family medicine to me was a great, again, mix of all these different things that I enjoyed. And so I'm, happy to say I'll be able to see all patients of all ages.
Yeah, awesome. So Dr. Wenzell's accepting new patients. If you're interested in joining his practice, you can go to our website, www.simplicityhealthdirectprimarycare.com. If you've made it all the way through this video, I promised, so you watched this whole thing. I just want to find out how to get my free t-shirt, right? And maybe you fast forward through all that. Yeah. If you did, there's some funny stuff. You maybe should go back. But so the t-shirt, we're giving away a t-shirt. We're giving away a hoodie. Again, if you're not lucky enough to get them, you want one, we can get you one at the office. Just let us know. But we're going to put this out on social media, so Facebook. So share, comment, say congratulations to Dr. Wenzell for joining our practice, and all the comments that we see, we'll enter you into a drawing, and we'll kind of raffle off a t-shirt, raffle off a hoodie, and so then you can have some swag at home. So it's so exciting for us. Yeah, so exciting for us to be able to grow our practice in this way, and man.
Excited to be joining for sure.
You're the perfect fit. Perfect fit.
Thanks. Awesome. We'll look forward to meeting all of you and meet and greet.
Awesome. All right. So if you want to sign up with Dr. Wenzell, call the office 937-813-2124. Talk to Michelle. She'll get you hooked up, or sign up on the website, www.simplicityhealthdpc.com.